Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my wonderful wife, Janet, and our producer, Lindsay, and we are streaming live from the Moses Lake Professional Pharmacy Studio today. And today we have Ron Barshop on the line with us. We had some technical difficulties getting him streamed in video, so we have him on the phone line, and you do not want to miss this episode. If you or anybody you know is on Medicare or Medicaid, i.e. government programs for healthcare, there is data out there that suspects that they are going to go broke within 4 years. Think about that. If you're relying on Medicare and Medicaid to pay your healthcare bills, they might be broke in 4 years. So Ron is an expert on this subject and many subjects when it comes to financing and pricing in healthcare. And I'm super excited to have him on. You do not want to miss out. Stay till the end of the show so you can find out about the solvency of Medicare and Medicaid. Ron, welcome to our show.
Hey, thank you, Janet and Shawn. I'm glad to be on.
Yeah, thank you so much. And let's start with, before we get to the solvency of Medicare and Medicaid, let's just start with part of the issue. I think one of the biggest issue with healthcare and why it's so expensive is because of lack of transparency. And because you're an expert on that subject, I don't need to go anymore. I'm just going to let you go and just talk about the transparency problem with pricing in healthcare.
Well, you can buy a jar of mayonnaise and you know what it's going to cost you. But imagine if you bought that jar and while you're driving home, somebody says, oh, by the way, that's a $122 jar of mayonnaise. And then all of your groceries got marked up like that. That's what's going on in healthcare. And it's a little bit of a cabal between the insurance companies who have no incentive to pay the fair price and the hospitals and the other rest of the system that's not interested in either. And they have a great big lobby. 1 out of 4 lobbyists that are walking the halls of your state capital and our nation's capital are ensuring that the game will continue to be played the way it is being played because it's way too profitable. But there is a new movement out there that's changing everything, you guys, and it's amazing because it's called direct contracting. There's about 20 million that work for employers that direct contract with the ecosystem, and they're getting away from these prices dramatically by paying fair price, a little bit of markup. And so when you hear about telehealth, that's really part of this movement. And telehealth is allowing us now to direct contracts combined with directly reaching the people that you need to reach to get your care. So it's a beautiful thing, and it's being accentuated by a transparency executive order, a series of them by Donald Trump, our outgoing president. So transparency means that you can actually see what you're paying, what they're paying, what insurance companies are reimbursing them at, and that is all about to get, we're about to blow the lid off and see what's underneath the black sheet. So no more Wizard of Oz dictating how we're going to live our lives in healthcare, and it's going to make really a big difference, and it's going to start in 2021 and 2022.
So tell us a little bit about that executive order from Donald Trump, the transparency and pricing from hospitals.
Yeah, it needed some comments by the Internal Revenue Service and other regulators, and they've issued their final orders now, and so it looks like it's definitely going to happen. We're talking about no more games, and that's going to start in, as I said, 2021, and the rest of it will start in 2022. So it's big news for consumers who are also voters, who are also patients, and everybody on this listening to this call is going to be affected by having the ability to see what's going on in behind the Wizard of Oz's curtain.
So I heard that hospitals and their lobbying groups are having pushback about this. They're trying to make it so they don't have to be transparent in pricing. Can you elaborate on that?
Well, if you can charge $120 for a jar of mayonnaise, you want to get away with it. Yeah, you don't want the consumer to see what's going on. And who is the consumer? It's the employer that's paying, and it's the federal government that's paying Medicare and Medicaid. So best not to see what's going on so they can charge whatever they want. And it's patently ridiculous. There's no other vertical in America that has that kind of gamesmanship. but there's also no other vertical that has that kind of lobby. So the tech lobby has about, well, if you put the tech lobby, big defense, you put big oil and Wall Street all combined, they still don't have the buying power of big healthcare, what I call the bigs. So they've done everything in their possible power to keep the game board rigged, to keep the dice loaded, to keep us from having a fair shot at playing on the healthcare game. And that's why I think a lot of anger on the streets has happened, is because, I mean, some of it was certainly political, but a lot of it was people don't feel like they're allowed in the treehouse of healthcare because it's too expensive and it's too unwieldy. And, you know, if you're only part of the 10% that can afford healthcare, then, you know, maybe you're upset. Everybody has a scary story or a strange story, but if you're the rest of America, the other 90%, they're sick and tired of this gamesmanship, and it looks like it's going to be over. I don't know what they're going to do with all those lobbyists once they get their transparency sheets removed.
I hope that's really the truth. I mean, it's a scam between hospitals and health insurances. They're in it together, and they are ripping off and scamming the American consumer and the American taxpayer, since most healthcare dollars is spent by by the federal government, which is paid for by the taxpayers. So that's something we'll get into later about the solvency of that. But the racket's got to stop. It would be illegal in any other industry. It's amazing it happens.
Yeah, and they've got it hardwired. Well, imagine Janet needs to get care, and she's got to buy an insurance policy that has a prostate exam in it, and you have the same thing. You want to get care, and you've got to have a women's well check built into your bundled pricing. It's ridiculous. So now we'll be able to take the lid off and see what's underneath, and we'll be able to pay item by item with this new direct contracting movement. And telehealth is also blowing the doors off, because it's 85% of all offices that don't need to have a doctor involved. You can have a televisit with a mid-level, and a lot of times a medical assistant can get the issues handled. So it's really a beautiful thing that's coming at us, and it's going to be hard for any politician to go backwards and, you know, take care of their lobby that's been paying their way. And go back to the old way, but the old way is about to be it's about to go away.
Good. The free market always wins in the end. Janet, do you have any questions or comments about this subject to Ron?
I do. What kind of movement do you see with providers in this? Because I know consumers have been sharing, but what kind of movement are physicians bringing and other providers bringing towards this transparency?
Well, there's new business models out there that didn't exist even a couple of years ago. So I've had on my show, I have a show called Primary Care Cures, and we've had providers on there that have created models that are what they call digital first and direct contracting. And the providers have gotten smart. They're sick of getting bullied. They're sick of having to do pre-authorizations. You guys got to do the same thing in your pharmacy. And it's really quite a racket. And so providers have gotten smart, and they're creating companies. There's been billions of dollars invested and millions of people joining this movement. It doesn't really have a name yet because it's not at an association. But you can bet your bottom dollar that the big companies don't want this to happen, and they're doing everything in their power to extend the status quo.
So speaking of those big companies, I think, in the past, one of the things that has happened is that, independent physicians, they sell out to big hospitals. So tell us why that is probably not necessarily a good thing.
It's a terrible thing. They don't even sell is a generous word, because it's like a shotgun wedding. They have to sell. Every pressure that can be made to bear on particularly primary care providers is to join a private equity group or the insurance companies. But actually, the biggest employer of primary care today is United Health, which has Optum Care.
Is that right?
Kaiser Permanente is another that is acquiring doctors, but only in a few states that they're successful in. They haven't been successful nationwide. But you're forced to sell because you've got every kind of pressure. In Texas, for example, the PCPs cannot bill for telehealth with two insurance companies. Can you imagine that? Can you imagine like the game that they had to play to get that? So in the same time that they said you can't bill, they're sending their customers, if you will, the patients that are members of those doctors' clinics, messages that you can come join our insurance company and still get paid on telehealth for free. So it's every kind of game, every kind of manipulation you can imagine. And, it looks like the playing field might be leveling out. But in the meantime, this crisis, the pandemic, has forced about 15,000 of the 30,000 remaining independents into the hands of the bigs or into retirement. The average age of, a third of the doctors are over 57 years old, and a lot of them are just sick of it. So there's a large ACO, accountable care organization in San Antonio, that lost about 10% of their doctors because they're just tired. They don't have the wherewithal to keep playing these games.
Well, you could actually argue, and I don't think it's government conspiracy. I think it's probably just fact that, lockdowns like this is a way for governments to control those independent physicians. The more they make them go into a big group, the easier it is for the government to control them. Do you have any comments on that?
Yeah, it just breaks my heart to hear you say it because it's so true. But they are being forced into the big groups. And then once they're in the big groups, they get paid more. They have less autonomy. They have greater burnout. We know that the medical errors jump markedly once you go with a big group owned by a big system. We know that the unnecessary tests that are ordered and the unnecessary procedures that are ordered increase markedly. So we know that big equals bad cost, higher cost, and we know it equals bad health, and we know it equals burnout. So it's like the trifecta of worst case scenarios is when you're forced as an independent to join these big institutions, you lose everything. And you're now working for the man. And they went into medicine and took on $350,000 in debt, took janitor's wages for 3 to 6 years for the privilege of helping us in the direst time of need. And now they're being forced to direct care into the bigs. I mean, did you know that urgent care, 70% of all urgent cares are owned by big institutions, and they're just basically feeder organizations for the hospitals so that they can have high insurance paid customers. So it's just you don't have to be a conspiracy theorist to say nothing about this is a good scenario for the doctors, for the patients. It's great for the hospitals. They by the way, they've had record profits the last 3 quarters because they're reporting their quarterly. We know what the for-profits are doing, and the nonprofits have to report too. They're doing great. This pandemic has been a golden era if you're a big institution.
Yeah, they're definitely loving it. And I was listening to a podcast from the great Dr. Keith Smith from the Surgery Center of Oklahoma the other day. And, he talked about urgent cares and ERs for hospitals. Hospitals complain all the time about how much money their emergency rooms lose. But he also finds it interesting that, they'll spend millions and millions of dollars remodeling those emergency rooms that they lose so much money on. So, it must be a way for them to generate lots of money for sure.
Yeah, there's two revenue sources. One is the ER itself, the urgent care itself. Then there's the referrals that they're naturally going to get by high insurance paid customers. So it's just let's just call evil when it is that. We can't mince around with words. It's a dark thing, and they're just really ravaging America. So I think you might want to talk about the Johns Hopkins study there. Marty McCary, who was on your show, I believe, or should be, he did a study with Johns Hopkins, and it turns out 48 cents of every federal dollar, either directly or indirectly, goes to healthcare, which is clearly unsustainable. So if you're a Social Security recipient, certain part of your income comes from the government is going towards healthcare. If you're looking at the interest on the debt to satisfy this giant deficit that this system's creating, a portion of that's paying the interest, and on and on. Veterans health, military health, defense health. It's all going towards an unsustainable model that this administration is going to have to deal with, or it's going to crash. I mean, there's literally no way around it.
Well, let's we'll get into that in a minute about. So you talked about 48% of our GDP is spent on healthcare. And yes, that does sound unsustainable. I mean, 50% of our GDP spent on healthcare alone. So you also mentioned in some of your social media that half of Social Security recipients do not have money to pay deductibles or premiums. So they're on Social Security and Medicare, but they can't afford deductibles or premiums. So, but they've got Medicare, so they're insured, right? Or are they?
Well, you're mixing up a couple of different posts. One of them is about 180 million Americans are with self-insured employers, and half of them, according to the Social Security Administration, they make $13.80 an hour. They don't have the scratch to put together a $500 deductible, and the average deductible is much higher than that. So they can't make their copays, they can't make their premium, they can't make their deductible, they can't afford the co-insurance if they had all that. So the self going to post the pig with lipstick. So what do you do if you're an employee working for that? Well, you can go to this direct contracting model and skip the insurance company and skip the employer. You can go with telehealth. You don't have to opt into healthcare for the employer. So I believe what we're going to see is a death spiral of the insurance companies like we've seen in Australia. And I believe in a couple of states we already have a death spiral, but it's being quietly handled by fixers in these insurance companies. But a death spiral is when all the young and healthy leave because they can't afford any of these payments anymore, leaving behind sicker, older patients. And it's like onion peel. You peel off the younger and healthier, and eventually all you have left is expensive, sick, older patients. So it's a pernicious circle. It's the insurers in Australia are begging for a bailout for a problem they created themselves. And it's going to happen here. Now, the insurance companies here are much better diversified, so maybe it may not happen as quickly, but they're definitely going to see it.
I agree with you. And, I wrote a book on it called Sickened, How the Government Ruined Healthcare and How to Fix It. And really, the government caused the whole problem. And that's why the insurance company keeps lobbying the government, because they want to keep their monopoly. They want to keep their cartel in place. And one of the fixes, I think, and this is, I in my book, I talk about a 6-step solution. And one of the fixes is that consumers completely get out of the insurance market. And they shop for cash prices for their health care. And there's health sharing programs out there now. They used to, most of them used to be faith-based, but there's non-faith-based ones now. I think the health insurance thing is such a racket. I don't believe in it at all. It's a ripoff. It's a scam. I never want to go back. Janet and I, we have a health sharing ministry and we love it. It allows us to go to the doctor we want to go to seek the services we want to seek, and to pay for the services we want to pay for. Like you were mentioning with healthcare, Janet doesn't need prostate stuff covered. I don't need OB stuff covered. And that's one of the reasons we got out of typical insurance, because in Washington State, we had to pay for a program that included maternity coverage. We're done having kids. Why should we pay for maternity coverage? I mean, so yeah. I do think that the future is going to change a lot, and consumers, the free market is going to win. There will always be some of those outliers, and there will always be the hospitals in bed with the insurance companies, and some people will be drinking the Kool-Aid about them and still going to those places. But I think consumers are waking up and realizing most of the time insurance is a ripoff, and you're better off paying cash for most services. Janet, you have any comments on that?
Well, I think one of the things that is really changed in the last year with what's gone on with the pandemic even is that people are asking questions. And I think that that's a good thing about what we're experiencing, because when we're in healthcare, I think when you put somebody in a financial situation with, they can be financially broke or devastated. I think that's against our the whole purpose of giving service to people and helping them. So, if we are in a system that's breaking the patients and the consumers, we need to start fixing that from the inside out. And that comes from providers themselves. I know consumers are going to drive that, but I feel like there's a moral responsibility to some of the things that we have put people in. You know, if you broke your leg, it shouldn't bankrupt you.
Let me ask y'all a question.
Go ahead.
Do you have your employees on a plan separate from the insurance companies?
So we have a very unique situation in our pharmacy, Ron. In 2002, we decided that health insurance was a scam and a ripoff. So we stopped billing insurance through our pharmacy. And because we realized that all insurance companies do is they decrease service, they decrease quality, and they increase price. That's all it did. So we decided to get out of that racket, and we no longer billed insurance, and it allowed us to offer the best possible price at the best possible service, and by getting that third party out of the way. So I'm not a big believer in employer-sponsored insurance, period. Even the TPAs that do it kind of directly, I don't like that at all. I think when somebody receives something for free, I think then they overutilize. They need to see value in what they and pay for it themselves. That way they will shop around on price, and that way they don't have to listen to me. They get to go to where they want to go to. Why would any employee want to let their employer tell them where to get health care? Does their employer tell them where to get food? Does their employer tell them where to buy a car? I think it's ridiculous. And that's why I would never do it directly, because it goes against our model that we pay for, that we tell patients that we don't bill insurance because it makes things more expensive. I believe we would be being hypocrites if we paid for healthcare for our employees. And I think that's one of the fixes in my book is that employees go to their insurance, go to their employer and say, look, I don't want this $1,500 a month healthcare you're giving me. It's a ripoff. So I want you to give me money in an HSA. I want you to do something, or just pay me more money, and I can do whatever I want with the money. And I think people are going to catch on to that. And if enough people, like you were just saying, enough healthy people do that, and it's only, sick people getting insurance through the employer just can't pay for it anymore. And I think that's a good thing. If you look back at the history of employer-sponsored insurance, it was caused by the government. In the 1940s, our wonderful president, Roosevelt, had an executive order that made it he put a price freeze on wages. And when he did that, the only way that employers could get new employees was they couldn't pay them more, so they offered benefits, and one of them was a hospital benefit. And now look at what it's came to. Now employees, because of their employer-sponsored insurance, they expect their stub toenail to get paid for, their diaper rash to pay for. They don't want to pay for anything. But in reality, they're paying a ton of money for everything.
Well, and to say what we do for our client or for our staff is that we work with direct primary care providers. So we encourage the wellness model versus the sick model. And some of our employees have chosen to go that route. And then we also give them information on the health sharing programs that are available. And so I know a couple, at least one or two in the top of my mind, I think of recently, that's what they've done. And I think when you give them a good path, I think like Shawn is saying that, better decisions are made, because primary care doctors that are in a direct care model usually do have a affordable route for them to take for better health choices and not being in the sick model.
Mm-hmm. Can I ask you all a couple of questions?
Please do.
It's a little bit subject change, but you guys are independent pharmacy. It seems to me that all the forces of the bigs are put to bear on you to sell your pharmacy for a song and a dance by restricting the type of drugs you can carry and cover, by not allowing you into these various market exchanges that allow you to buy the drugs so you can offer them to your patients at a fair price. How are you guys surviving? I mean, I appreciate your strategy since 2002, but how are you surviving with all of this pressure brought to bear on your pharmacy?
Well, I mean, for one thing, I think in order to survive, you have to do something unique. And we've done that through compounding. We're pretty much a compounding only pharmacy. And that means we mix up most of our medications and we focus a lot on hormone replacement. 85% of our compounds are hormone replacement. We focus on a health and wellness model. So we do a lot of things to keep people healthy, including hormone replacement. And if you want to be controlled as a pharmacy, that's when you start billing insurance. Because if you are controlled as if you start billing insurance, you will be controlled as a pharmacy. You can still have, in my opinion, you can still have a very successful pharmacy. And if we didn't have a niche that we did in compounding, one of the things that we could do is, I think we could. There's a niche for a pharmacy to sell generic drugs very inexpensively. When you look at a lot of the prices in a Rite Aid or something like that, we'll get calls and patients will tell us that they're being charged $70 for a medication that we would charge $15 for. Why? Usually because those companies, kind of like we've been talking about, they're not transparent in pricing. All they know about is billing an insurance company. So then they rip off the consumer that doesn't have insurance. And so there's still a model for that. I think that the more you can be independent and away from the insurance companies, that's how you don't be controlled. And I think the biggest thing is, and this is what we promote at our pharmacy, and it's the number one solution in my book. The first solution is patients have to be proactive in their own health, period. That's one of the reasons we have this podcast, to educate and empower consumers that they're in charge of their own health. And that includes their own healthcare finances. So first of all, the best health insurance we have, chapter 6 of my book, quoted, the best health insurance we have is not some kind of policy that we can buy. It is how we take care of ourselves. So first and foremost, you have to take care of yourself. That's the best health insurance you have. And we promote that with our staff and we promote that with our patients. And I think we live it ourselves. So great questions, Ron. Thank you.
How are you surviving the PBMs that are trying to get in the middle and dictate how people should buy their product? I guess you've done it by opting out, by stepping away from them.
Right. We're just not involved with them. We are totally, PBMs have nothing to do with us. And I hear about some of the pharmacies, the stuff they deal with PBMs. And I follow a friend of mine on Facebook. He owns a pharmacy in Florida. And I mean, they are ridiculous. I mean, they pay him nothing, like $1 over his drug cost. So obviously he's losing money. And, the only way, and Jan and I have been there. We were there for many years in our pharmacy that, we had these trade groups that would try to lobby Congress and lobby the states and all this for better reimbursement. It ain't going to happen. The only way to change the system is to get out of the system, period. That's why you've seen a move. Right. That's why you've seen a movement to direct primary care. As you know, Ron, those doctors realize they're not going to change the system inside. It's a cartel inside. It's a ripoff. It's a scam. The hospitals and the big corporations are in collusion with insurance companies and big pharma. The only way to get out, or the only way to fix it, is to get out and do your own thing and be independent, period. And that's how the patient is going to get the best care. We thought that, and the DPC doctors think that.
Well, my favorite quote I had from our guests in the last 2 years since we started this show was Keith Smith, who you referred to earlier. And he says, don't expect the driver to get the driver of the getaway car to solve the heist. And he's got like 1,000 like that. The guy's great.
I love him.
Started the free market.
Yeah.
Well, one of the reasons that we took a different direction is I had a client that served her for many, many years. And one day she called us and she was 50 years old and she was dying. And the reason she was dying is because she was morbidly obese, but she was taking, 20 different drugs. And, it occurred to me during our conversation that perhaps I didn't help this individual very much by continuously giving her drugs that maybe put her in the grave faster than needed to be. I mean, there are other things that we can do for people besides giving them sacks full of medication. For one, no one really in my mind was really helping her handle her major problem. And, one of the things I think as providers that we forget to do is, what's the best answer for that client? Her bags of insulin maybe kept her alive for a short period of time, but I mean, it ultimately put her in the grave. And so, we started talking about the sick model of how we are keeping people in the spiral and we're not really helping them. Ethically and morally, I know that, cardiac diseases and, diabetes and stroke are up there in our country. And that's what's killing our population. And if we don't do a wellness model for them and work with them, then I don't feel like we are really helping them. We're assisting them.
Yeah, we had a guest on who is the head of the MRSA Survivors Network, and God bless this woman. She got MRSA herself from her hospital in Chicago,
Of course.
Great name hospital, well known. And she gave us the numbers. It's like it's the third leading cause of death in America is hospital-acquired infections. So one of the smartest things you can do as a consumer is just not need the hospital in the first place by
Get out.
losing weight, by walking in the daytime. Yeah, get some vitamin D, get some sunshine. I walk 4 hours for an hour this morning, and I do it every day. So I'm 61. I'm off all my meds now. It's the only way to really stay out of the hospital is to not need it in the first place by taking care and charge of your own health. And you don't need a doctor to do that. It's free. There's no deductible. There's no copay.
Exactly.
That's correct. Being proactive in your own health. And hospitals are one of the most dangerous places to be. I don't know the stat off the top of my head, but if you look at, a percentage of patients that die in hospitals, it's huge. Now, you could argue that's because sick people go to the hospital. Well, that's kind of my point. But when you look at nosocomial infections in a hospital, it is a big deal. Stay away from hospitals if you can. And that's why for most acute things, I recommend DPC doctors, because most DPC doctors can do a lot of things that would keep you out of the hospital, i.e., stitches and broken arms. And, as long as it's not, compound fracture or something, it needs to be, set or surgery. And I recommend that. Stay out of the hospital. It's one of the most dangerous places. And of course, the most expensive places. And you never know what the bill is going to be. You find out 6 months later sometimes.
Kind of a joke.
It is. It's very sad. I'm being cynical, but I don't have a lot of good things to say about hospitals. So
yeah.
Let's go on. So, you say that Medicare and Medicaid is going to be broke in 4 years.
Well, yeah, it's just math. The math is actually it's broke now because we're using Social Security to fund the deficit. So technically, we have foisted all we can on the future generations, and the piper has to be paid now. So what are we going to do? Will deficit spend more and foist more on the future generations of our debt? So there is no easy answer. They can extend our age another year or 2 or 3 and say you can't get the product within, or maybe they can raise the rate of your income qualification so you can't get some Medicaid. This federal government looks like it's going the opposite direction. They want to lower the qualifications to get into Medicaid. They want to make a Medicaid for all. And all you have to do is look at Veterans Administration for what that healthcare looks like when you have federal mandated, federal paid for healthcare. It's the waits are ridiculous. The doctors aren't getting paid properly. One of my doctor friends had to make a cardiac referral, and they had pain in their heart, in their chest, angina. And they couldn't go see a cardiologist for 6 months until they verified that they actually needed a cardiologist. Well, what's that pain all about? So this is what's coming at us. We're going to have longer waits. We keep talking about Canada as some kind of miracle healthcare. They hate their healthcare there. I mean, it's not working. But the lines are long. If you're wealthy, you are okay. But the rest, 90% of the people don't have good healthcare, and it's what we're going to have: longer waits, worse care, fewer doctors doing well. It's a no-win situation for all the players that are involved.
Well, again, referencing Dr. Keith Smith, he has talked that he has many patients that come down from Canada and pay cash for surgeries at his surgery center because they've got to wait years for certain surgeries. So they come down to America and
yeah, you want to see what his prices are? Go to his website. He'll show you the transparent pricing of every possible surgery you could imagine except for birth. It's just, it's all there laid out. So when hospitals say that they can't, it's going to take 20,000 spreadsheets to show what they're doing. No, just go to Keith Smith's website, Oklahoma Surgery Center of Oklahoma, and you'll see every possible surgery you could imagine priced out. All in pricing, not, it couldn't be more transparent. He's been doing it for 20 years, by the way. This is not a new idea.
No, it's not, but it is gaining traction, and we owe a lot to him in the free market. And speaking of the free market, I'm an optimist. Do I think Medicare and Medicaid are broke currently? Absolutely. Do I think that it's the answer to the future? No. What are we thinking if we're broke now with those programs, and how can we do Medicare for all? How are we going to afford it? Here's what I do know. I'm a big believer in free market solutions, and I do know that the free market will work, and people will find out how to get healthcare, better quality, better service at a cheaper price, and it won't be through the government because the government caused all this problem. So, Janet, you want to comment on that?
Well, I think one of the things that when I talk to people about insurance and healthcare is that, this phenomenon about healthcare has been very short-lived throughout time. Prior to health insurances, doctors, physicians, midwives, they dealt, and hospitals for that matter, dealt with the consumer or the patient. And so, it's not like it's been happening for centuries this way. In fact, it's only been decades. So I do think that we need to balance with time. And I feel that if we can get more providers out of that system and actually taking care of their patients, I think the solutions for cheaper healthcare and quality healthcare is there because, what's accepted or what the standard of care is not always quality in my mind. Quality is totally different than what we may be seeing and what's useful. And some of the clients that have came in and talked to me say, well, you feel more comfortable when you have an organization like a big clinic or a big hospital that, they're going to be the experts. And I unfortunately think of the person with that angina and say, that's probably a story I could say, and probably 10 stories that with my mother who is on Medicare that, all these things that her doctor wanted to have taken care of immediately, they knew, but they had to jump through all the different, well, you have to have this test, and then you have to have this done, and then then maybe we can give you this, and then maybe we can go there. Well, it would have been less expensive if we would have treated the client and the patient up front for what we thought they needed to be treated for, instead of all these other procedures that led down the same road. And, is it that we're trying to get rid of grandmother? I don't necessarily believe that, but all these restrictions and all these little, well, this, then this, or maybe that, then this, has taken the doctor out of the picture. And I think that's just wrong.
Well, go ahead.
Are there any employers left even in Washington to talk to anymore because of this nanny state pandemic reaction, this giant knee jerk of using a blunt instrument to close businesses and shut select industries down? Are there anybody left to even buy your product anymore? Because it seems that these nanny state philosophies are dominating right now.
Yeah, that is true. But also when you look at those nanny states, they're going broke. So, and a lot of people, that are productive citizens are leaving those states. So there again, I believe in free market solutions. Ron, you said upping the Medicare age is not the answer to fixing the Medicare solvency problem. So what is the answer?
Well, it's complicated because like for the veterans, we don't want more veteran administration. The ideal solution would be to give everybody a debit card with the amount they're spending in the VA per patient and let them make a choice. As you said, free market's going to decide. It would work just as well for Medicare, too. Let the Medicare patients have funds to make their own decisions. But that's not going to happen again because of these entrenched interests. So the game is rigged. There really is no way to fix this thing with solutions. If I were a Medicare recipient, and I will be in a few years, I would just have a direct primary care relationship, and I would have a sharing ministry, and I would use that as my go-to to get what I need to get done, because it's really the only option right now. There's not a lot of people that are on Medicare that don't have a lot of medications are very happy with it because it's free, and but that's a tiny portion of the Medicare population. Most folks have multiple chronic conditions. They rely on their Medicare plan to get them through the day. So, there is no solution if it's not a market-based solution.
Yeah, I agree. And I think one way to let the market work is to actually repeal Medicare, honestly. And I know that's a powerful, powerful statement, but I talk about that in my book. The only way we're going to fix it is to repeal Medicare. And honestly, Medicare piggybacked on Social Security, and Social Security is part of it. I mean, Social Security is bankrupting us also. And we just cannot continue to have these programs where the federal government steals from the taxpayers to give to who they see as fit. That is what is bankrupting our country. And I'll get a lot of pushback with that. It's like, oh, I talked to one of my congressmen one time. He goes, oh, you can't repeal Medicare. And I'm like, well, we repealed prohibition. Why can't we repeal Medicare? So consumers can speak. It could happen. Who would have thought that 20 years ago, if you would have asked me that marijuana is going to probably be legal federally, I would have said, you are crazy. Look, it's going to be legal here pretty soon, or at least decriminalized, federally even. Lots of states already see it legal, but federally it's still illegal. So I'm still optimistic that we can repeal Medicare. We need to get the government out of healthcare, period. That is one of the ways that we have to fix it. Yes, that's a very strong statement. But another way is get the states out of Obamacare. If the states just stop taking federal dollars to let them and let them decide how they're going to take care of the constituents, then that would even be a first step. But long-term step, get rid of Medicare totally.
So do you enjoy your job? Do you enjoy what you're doing for a living? Or let me ask you another question another way. Would you advise your children, I'm assuming you'll have children, to go into the pharmacy business?
This is what I would tell them. Jan and I love what we do. We have a passion for what we do. We often say we're never going to retire because we feel like we're retired now. We love what we're doing. We're making a good living. I would be very careful to talk to anybody to go into pharmacy, because this is what I tell them. I'd say, look, we've created a great business model here. We love what we do. We get to educate and empower patients. We get to take care of them without any insurance interference. And we created that model. It was not easy. It was very difficult. But I also warned those students, and I'm a preceptor for pharmacy students from 2 colleges of pharmacy. I will tell them, here's the reality. You're not going to work in an environment like this. You're going to work for Walmart. You're going to work for Rite Aid in a chain store, and it sucks. Okay. You're going to be working 9 to 12 hours, no lunch, no break. You're going to be counting pills for a living and collecting insurance copays, period. I wouldn't do it, Ron.
Pharmacist, and she hated her life so much that she opted out. She's going to do something else. I mean, it was killing her. It was literally killing her. She's 27 years old. She's a young lady, and she's burned out at 27 from pharmacy. It's not, I don't think she expected, when she got into that practice, that she was going to be counting pills all day long and not taking potty breaks.
No. And I good for her, because I don't know how many people have spoke to me over the years about, we've all confronted that healthcare provider that's overwhelmed, and, they are at the end of their rope. And it isn't that they went into healthcare to not take care of patients, but they feel like they are against the wall, and what they are doing is not bringing them any happiness or purpose. But I will say this, Shawn and I had the conversation the first year that I graduated and was working, and I said, if this is what I went into, I'm not going to stay here, because again, you could work all day. You could be there from 9 to 9, and nobody cared if you got a lunch break or a dinner break or a potty break. And that's wrong. That's not, and physicians get stuck in that same position too. And I felt like, I'm an adult and I have a lot of years ahead of me to work. and this is not how I'm going to do it. And, sure, it took a while to get out of that situation. So good for her that she made better choices, because that ruins your health too. Your emotional, your mental, your physical. There's no reason to stay in a job that is so toxic.
Right. And most pharmacists, most doctors, most nurses don't like what they're doing. And I think one of the reasons why is because of the insurance model. And if you talk to, we've interviewed direct primary care doctors from all over the nation who, they don't accept insurance, obviously. And you know what? They're happy. Yeah. I mean, right away, you can just tell that it's just different, and because it's liberated. And that's what Jan and I feel, and I was at the Free Market Medical Association meeting one time, and I got to speak in front of a group of them. And one of the things they ask is how we were able to thrive in an environment like that, without insurance and stuff. It's like, well, first of all, it's not just about survival or thriving. To me, although we've done well, what's actually is thriving to me is being liberated that I have autonomy over my own practice, and I can deal with patients directly instead of letting a third party insurance company tell me what is best for the patients. It's very liberating. We don't have to wait for payments anymore. The patients pay us directly. It is very liberating. We love what we do. Unfortunately, most pharmacists don't.
Very nice.
So, Ron,
keep up the good fight, you guys. Y'all are doing good with this podcast and this YouTube channel. It's important work you're doing and that I'm doing. Keep telling the truth.
Yeah, right.
Having great guests like Regina Harshlinger on.
Yeah, that's why I wanted to have you on. So, Ron, what drives you? What do you have a passion for?
Well, I want to see everybody win, and I see in this the direct primary model and direct contracting model, the people are winning that are patients, that are doctors, people that are employers are winning. The folks that are in the ecosystem are winning. Healthcare as a cost center is winning because it's going down. That population health is increasing because people are taking charge. So what drives me is to see more people join this movement that doesn't have a name. I think we should call it the Shawn Needham movement until we come up with a better name.
Right. Well, thank you for that.
Maybe Janet could,
Thank you for that, but I don't think we deserve that. I think our people like Keith Smith, who are pioneers, and he started doing it in 1997. We didn't, or 98-ish. We didn't really start getting out of the insurance model until 2002. So, but I do think that it's the future of healthcare. I really do, and. Yeah. So, Ron, what's the best way to get a hold of you if somebody has questions or wants to get a hold of you?
I'm easy to find on LinkedIn, and very happy to talk to folks that have questions about how this is working and what's working. You opted out since 2002. I've opted out and used a company called Redirect Health out of Arizona for 3 years now, and all my employees would not leave me if they had to. I mean, they're free there's no insurance, there's no premium, no copay, no deductible. They get free insurance the day they start with me, and it's a thrill because I can join a movement with my feet. I can vote with how I take care of my people.
Yeah, that's right.
And I can tell you that we have zero turnover. We have no problem hiring good people because they're easy to hire when you say free healthcare. And I can tell you our absenteeism and our presenteeism has dropped dramatically. So I'm in the movement. I'm in the game, and all my people are winning. I'm winning. I'm thrilled to be part of this and see more people join it.
Good for you. Well, keep on winning, Ron, and we appreciate you being on the show today. Okay.
Thank you very much, y'all. Good luck to you.
All right. And tune in to our midweek podcast. It'll actually be Wednesday this week, 8 to 9 a.m. Pacific Standard Time. We will have a doctor from Primary Care Cures. Pioneer Health Care out of Oklahoma, Dr. Kelsey Smith. And so stay tuned for that on our midweek podcast, Wednesday, 8 to 9 a.m. You can catch us every Monday, 1 to 2 p.m. right here on my personal Facebook page or the Moses Lake Professional Pharmacy YouTube site, always streaming live at those times. And please subscribe to the Moses Lake Professional Pharmacy's YouTube site so you don't miss any of these episodes. Ron, thank you for being with us today. You've been listening and watching Health Solutions with Shawn and Janet Needham.